Did you know that up to 1 in 3 adults worldwide may have insulin resistance? And most of them have absolutely no idea, no obvious symptoms, no warning label, just a silent shift in your body's chemistry that quietly raises your risk for type 2 diabetes, heart disease, fatty liver, and even certain cancers. Today, we're pulling back the curtain on one of modern medicine's most important and most misunderstood conditions. By the end of this video, you'll understand exactly what insulin resistance is, why it happens, how to know if you have it, and most importantly, what you could do about it. Welcome to HealthSphere MD. Let's get into it. Before we talk about resistance, we need to understand what insulin actually does, because it's one of the most powerful hormones in your entire body. Here's the simple version. Every time you eat, especially carbohydrates and sugars, your blood glucose rises. Your pancreas detects this rise and releases insulin into the bloodstream. Think of insulin as a key. In your body cells, in your muscles, liver, and fat tissue have locks called insulin receptors. When the key fits the lock, the cell opens up and absorbs glucose. That glucose is then used for energy or stored for later. Without insulin, glucose stays trapped in your bloodstream. Your cells starve. Your blood sugar stays dangerously high. This system works beautifully when everything is functioning normally. But what happens when the locks stop working properly? That's where insulin resistance begins. Insulin resistance is exactly what it sounds like. Your cells become resistant. They stop responding properly to insulin signal. The key is still there, but the lock is jammed. So what does your pancreas do? It does the logical thing. It produces more insulin, trying to force the door open. For a while, this works. Blood glucose stays relatively normal, but only because your pancreas is working overtime. This state, high insulin, normal-ish glucose, is called compensated insulin resistance, and it can go on silently for years. But here's the problem. Over time, your pancreas gets exhausted. It can't keep up with the demand. Insulin production falls. Blood glucose starts rising. First, you reach prediabetes. Then, if nothing changes, type 2 diabetes. And the damage doesn't stop there. Chronically high insulin, even before glucose rises, harms your blood vessels, drives inflammation, promotes fat storage, and disrupts hormones throughout your body. Insulin resistance isn't just a diabetes story. It's a whole body story. So what actually causes insulin resistance? The answer is multifactorial, meaning several things contribute. But some causes are far more important than others. Number 1, excess body fat, especially visceral fat. This is the fat stored deep inside your abdomen, around your organs. Visceral fat is metabolically active. It releases inflammatory signals called cytokines that directly interfere with insulin signaling at the cellular level. This is why waist circumference is such a powerful predictor of metabolic disease. Number 2, physical inactivity. Your muscles are the largest consumer of glucose in your body. When you exercise, muscle cells absorb glucose even without insulin, and they become more sensitive to insulin for hours afterward. A sedentary lifestyle eliminates this powerful glucose disposal pathway. Number 3, poor diet. Ultra-processed foods, refined carbohydrates, and added sugars create repeated glucose and insulin spikes. Over time, this constant stimulation desensitizes the receptors. Number 4, chronic sleep deprivation. Even 1 or 2 nights of poor sleep can measurably reduce insulin sensitivity. This is not optional. Sleep is metabolic medicine. Number 5, chronic stress. Cortisol, your stress hormone, directly raises blood glucose and suppresses insulin action. Modern chronic stress keeps cortisol elevated, chronically impairing metabolic function. Genetics plays a role too. Some people are more predisposed. But for most people, lifestyle is the dominant driver. And that means it's also the dominant solution. Here's the difficult truth about insulin resistance. It's often silent in the early stages. But there are signs if you know what to look for. Fatigue after eating. If you feel a significant energy crash 1 to 2 hours after a carbohydrate-rich meal, your cells may not be efficiently absorbing that glucose. Difficulty losing weight. High insulin levels powerfully promote fat storage and block fat burning. Many people struggle for years with weight loss, not knowing that insulin resistance is the hidden obstacle. Sugar and carbohydrate cravings. When cells can't absorb glucose properly, the brain interprets this as a fuel shortage and signals intense cravings for fast energy. Brain fog and poor concentration. The brain is highly dependent on stable glucose. Dysregulated insulin signaling affects cognitive clarity. Dark patches of skin, called acanthosis nigricans. These velvety, darkened patches appear on the neck, armpits, or groin. This is a direct skin manifestation of high circulating insulin. Increased waist circumference, particularly if fat accumulates around the belly. This is both a cause and a consequence of insulin resistance. If several of these resonate with you, speak to your doctor. Testing is simple. Diagnosing insulin resistance doesn't require anything exotic. A few straightforward blood tests, combined with physical assessment, give a clear picture. Fasting glucose. A simple blood test taken after an overnight fast. Normal is below 5.6 millimoles per liter, or 100 milligrams per deciliter. Prediabetes range is 5.6 to 6.9. Diabetes is 7.0 and above. HbA1c, glycated hemoglobin. This measures your average blood glucose over the past 2 to 3 months. It's one of the most reliable markers of long-term glucose control. Below 5.7% is normal. 5.7 to 6.4% suggests prediabetes. Fasting insulin. Often overlooked but critically important. High fasting insulin with normal glucose is the hallmark of early insulin resistance. Many doctors don't order this routinely, but you can ask for it specifically. HOMA-IR. This stands for Homeostatic Model Assessment of Insulin Resistance. It's calculated from fasting glucose and fasting insulin. A score above 2.0 raises concern. Above 2.9 strongly suggests insulin resistance. Lipid panel. Insulin resistance commonly produces a characteristic pattern: elevated triglycerides, low HDL cholesterol, and small dense LDL particles. Waist circumference. Greater than 94 centimeters for men, 80 centimeters for women signals elevated metabolic risk in most populations. If insulin resistance is left unaddressed, the downstream consequences are serious and wide-ranging. Type 2 diabetes is the most well-known. When the pancreas can no longer compensate, blood glucose rises into the diabetic range. This causes nerve damage, kidney disease, blindness, and cardiovascular complications. Cardiovascular disease. Insulin resistance drives hypertension, dyslipidemia, and chronic inflammation, a triple threat for your heart and blood vessels. People with insulin resistance have significantly elevated risk of heart attack and stroke. Non-alcoholic fatty liver disease, NAFLD. Excess insulin drives fat accumulation in liver cells. This can progress silently to cirrhosis. Polycystic ovary syndrome. In women, high insulin drives excess androgen production, disrupting ovulation and causing a cluster of metabolic and hormonal symptoms. Certain cancers. High insulin acts as a growth factor. Colorectal, breast, and pancreatic cancers show associations with insulin resistance and hyperinsulinemia. Alzheimer's disease. Increasingly, researchers refer to Alzheimer's as type 3 diabetes. Insulin resistance in the brain impairs neuronal function and accelerates neurodegeneration. The message is clear. Insulin resistance is not a minor issue. It sits at the center of the modern chronic disease epidemic. Here's the most empowering part of this entire video. Insulin resistance is largely reversible, and lifestyle is the most powerful medicine available. Diet, the single most impactful lever. Reducing refined carbohydrates and added sugars directly lowers glucose and insulin spikes. Foods that improve insulin sensitivity include non-starchy vegetables, fatty fish, olive oil, nuts, legumes, and low glycemic whole grains. Some people do well with a low carbohydrate or Mediterranean-style diet. The key principle: choose foods that produce a modest, stable insulin response. Exercise, the fastest-acting intervention. A single bout of moderate exercise improves insulin sensitivity for up to 48 hours. Both aerobic exercise, walking, cycling, swimming, and resistance training, weights, bodyweight exercises are effective. Aim for at least 150 minutes of moderate activity per week, with 2 resistance training sessions. Weight loss, even modest amounts matter. Losing just 5 to 10% of body weight significantly improves insulin sensitivity. The mechanism is largely via reduction of visceral fat. Sleep optimization. 7 to 9 hours of quality sleep per night is not a luxury. It is a metabolic requirement. Prioritizing sleep hygiene is a genuine medical intervention. Stress management. Reducing chronic cortisol through mindfulness, breath work, or simply building adequate rest in a daily life has measurable effects on insulin sensitivity. Medications, when needed. Metformin is the most commonly prescribed medication for insulin resistance and prediabetes. It reduces hepatic glucose production and improves insulin sensitivity. Newer agents like GLP-1 receptor agonists have also shown powerful metabolic benefits. Medication works best as a complement to lifestyle, not a replacement. Let's bring it all together. Insulin resistance is a condition where your cells stop responding normally to insulin, causing your pancreas to overproduce it and setting the stage for a cascade of metabolic consequences, including type 2 diabetes, heart disease, fatty liver, and more. It's driven primarily by excess visceral fat, physical inactivity, poor diet, sleep deprivation, and chronic stress. It's often silent, but there are signs, and it can be detected with simple blood tests. And crucially, for most people, it is reversible. Diet, exercise, sleep, and stress management are the 4 pillars of metabolic recovery. If today's video gave you even one insight that changes how you think about your health, please share it with someone who needs to hear it. Like and subscribe to support more evidence-based health education from HealthSphere MD. Until next time, take care of yourselves.